Virtual reality created by computers or digital technology. Sitting on a living room sofa, the moment we wear a headset, the scene in front of our eyes changes. The soles of our feet still feel the carpet, but ahead, a cliff opens and clouds gather. The brain senses danger, the body remembers safety. In that gap, VR creates the experience of having entered. Virtual reality is a technology that uses computers and digital tools to create an environment like the real world, making users feel as if they are inside it. Rather than adding something on top of reality, VR creates an entirely new world and places people within it. For this reason, the defining feature of VR is that it relies on images and visuals that are 100% virtual. The most important element of VR is immersion. To feel truly convincing, visual information alone is often not enough. Sound, movement, and a sense of distance must work together, and when possible, sensations such as touch and temperature are added as well. Vision still dominates, and smell remains a more distant sense, but efforts to engage all 5 senses continue. As a result, more companies now seek developers for 5-sense interaction. So how is a VR space created? Creating a VR space resembles building an invisible stage first, then layering sensations one by one. The process begins by planning the world to be created. Spaces and objects that support that world take shape through 3D graphics. Forms receive color and texture, and viewpoint, distance, and movement are designed together. A sense of being there emerges. Finally, sound and interaction are added, completing a world that does not exist in reality, yet remains fully experienceable. One of the main fields where virtual reality is used is education. It allows easy access to information and supports self-directed learning. For example, when VR is introduced into physical education classes, students can experience activities such as archery, bowling, and golf. Activities that are difficult to conduct in regular classes can be experienced like a game. This scope continues to expand into training programs for drone operation, aircraft maintenance, and automobile driving. VR is also used in therapy. Phobia treatment is a representative example. VR therapy helps patients gradually face fear-inducing objects in a virtual environment, allowing familiarity to build step by step. For a person who fears dogs, the process may begin by seeing a virtual dog from a distance, then from closer ranges, and eventually progress to simulated touch. Because the environment is virtual, the risk of real harm is reduced, and therapists can control the situation more easily. The session can be stopped at any time and repeated as needed. Treatment can also be designed with greater flexibility outside the hospital. With fewer constraints of time and space, it is easier to adjust the pace and stages to suit each patient. Because it takes place in a virtual environment, exposure in public settings is reduced, which can help protect privacy. Thanks to these advantages, recent studies report that VR therapy may help alleviate symptoms of fear of heights and social anxiety. Although virtual reality can offer powerful experiences, it does not always lead in a positive direction. Prolonged exposure to VR screens can cause dry eyes, headaches, and dizziness, and it may also lead to addiction to VR content or difficulty adjusting to real life. Excessive immersion in virtual worlds can further result in reduced communication in the real world and dulled senses. Virtual reality is not a world that replaces reality. It is often closer to a safe space for practicing how to live better in the real world. As much as a door opens into the virtual, the strength to step back into reality is also needed.